Hello, I'm Donald Macaulay, and welcome to medicsvoices.com, where we talk to the key opinion leaders around the world. Today we're in California, and I'm talking to Cindy Hawk. Now, Cindy, normally I would ask a question about your career, but I'm going to ask you a slightly different question, because I know you've been known to wear a lapel pin that expresses your philosophy, and that is, the best things in life aren't things.
The best things in life are really, in my opinion, it's relationships, it's connections, it's making those connections that are deep, that are real, that are meaningful, that are inspiring. And I happen to be the mother of four now adult children, five grandchildren. And I just feel so blessed and so fortunate to have a wonderful family, a network of friends, of colleagues, of former students that are now out in the world doing wonderful things that I can feel a sense of connection to. So for me, number one, it's relationships. And then if you can add in experiences with those relationships, then the magic really begins to happen because those shared experiences bring people together, whether they're good or bad. Sometimes it's the most difficult ones that create the tightest bonds. So for me, it's all about the relationships, the connections we have, not just with people, but also with the natural world. And I think what a wonderful blessing that we're surrounded by nature and can touch and feel that connection every day.
Now, that philosophy has clearly guided your life. So let's take you back to the very beginning. And your life has been, in an academic sense, a little bit unorthodox, as was your interview for medical school. So tell us about your interview for medical school.
I was an undergraduate at Indiana University studying biology. And as I was coming in my senior year, I was thinking I could be a teacher, I could be a research scientist, but wow, I could be a doctor and maybe do all of those things. I could teach and learn and conduct research and actually help people every day. It became very compelling. So as I went to visit my advisor, my academic advisor, because I'd applied to medical school and I really hadn't thought my chances were great. I hadn't been pre-med, but I applied and then was invited for an interview. So I thought, oh, this is getting serious now. Maybe I should get some advice. So I went to my advisor and I said, I'm going for this interview. Is there anything I should know? She looked at me. I was wearing pretty beat up blue jeans and a flannel shirt. And she said, first of all, you must buy a suit. You can't look like that. And you must be wearing a suit. And on top of it, as she learned, I was already married and I had a child. She said, under no circumstances should you tell them that you're married or you have a child, because you definitely will not get in. So I listened to her advice. I went to the Goodwill and I bought a $3 suit. It was very ugly looking, but it was a suit. And I drove up to Indianapolis for my interview. And we sat in a room with all the students who were being interviewed very nervously. And I was finally called in, introduced to this gentleman who was introduced himself as a psychiatrist. And I sat and he asked me a lot of questions about my motivation, my background, my interest. At one point he said, aren't you a bit naive? Are you sure you know what you're getting into? And I said, maybe I don't know what I'm getting into. And yes, I probably am naive. And we talked a bit. I didn't have any doctors in my family. I really hadn't been immersed in that environment. But I just had this sense of that it would be a good fit. And so then he asked me, so what do you like to do in your free time? And I froze. because at that point I felt like psychiatrists could read your mind. They had special powers and they knew exactly what you were thinking, whether you said it or not. And so here I am in this moment. What do you do in your free time? And my advisor said, absolutely don't say that you're married. Don't say that you're a mother. And I knew he could tell. He would be able to read my mind. So I, after a moment of pause, I said, well, I'm married and I have a child and I love spending time with my family and being outdoors and taking walks and going for picnics. And well, that was it. I knew I'd blown it. I'd never be admitted to medical school. And I went home with my tail between my legs, and told my husband, well, that's that, I probably won't be admitted. And a few weeks later, I get a little thin envelope in the mail, which I was sure was my rejection letter. And I opened it and I found out I'd been admitted. So that was my admission to medical school. It was a bit of a shock, really, but I'm very grateful. Yes.
So then you did your medical training and you completed your medical training. And after that, you took the road less traveled.
Well, in a way, yes. So I knew I wanted to work abroad. My father was from India and my mother from Indiana. I'd grown up partly in Pakistan. I'd seen a lot of poverty. And I knew that I wanted to be a physician working in areas of great need. And so, probably to me, that meant I needed to go abroad and work in, at the time, we called it international health, now global health. And so, in those days, there was a journal of the American Medical Association every other year listed physician volunteer opportunities abroad. And I went through that listing and I found every place that would accept a family doctor with her husband and by then 3 children. Okay. Because I didn't want to go and leave them behind, of course. My family was so important to me. And also, since I'd grown up partly abroad, I knew it would be important for the children to experience life outside of the United States. And so in the end, I was accepted to become the medical director of a rural health center in Kasangati, Uganda. This was in 1986, end of the Civil War. And at the time, Uganda had about 13 million people and about 200 doctors. Most of the doctors had either been killed or they'd run away because of the very brutal civil war. And so they were quite desperate. They would take any doctor that would be willing to come. So that was my first job. It was actually towards the end of my residency training. I was able to talk my program director into allowing me to take an independent elective in pediatrics in Uganda. Yes. And the project was to improve child survival. At the time, 1 in 3 children were dying before the age of 5. It was a very difficult situation. And so that was my elective in child survival. We went for 3 months. My husband, who was always a good sport, he agreed to come along, and our children were then 9, 4, and my youngest daughter, Heather, turned 2 while we were there. So that was my first really independent job. And most of my family and friends thought I was crazy. And I thought I was crazy too once we got there and I found out how difficult it was. I was quite naive. But fortunately, we made it through that situation. And in fact, it was a game changer for our lives. It was very difficult, but it was also very rewarding and very inspiring. The people were so generous and hopeful and grateful for our presence, and they surrounded and protected us.
You described it as a game changer. And I think someone, a mentor or a colleague, said something to you that influenced your life, and it was You can't cure everybody, but by teaching people, you can spread the word. So tell me a little bit about your career as an educationalist, as an academic.
Well, it was actually Josiah, he was the manager of the health center in Uganda, where once I came, he said, I know you're a doctor, you're trained to treat patients, but he said you could treat patients here 24/7 until you die and not make much of a difference. But if every time you see a patient, you're teaching one of my staff, then when you leave, you'll leave something important behind. And that was such important advice. Um, so from that experience, basically, I learned that my willingness or interest in caring for patients was not sufficient with the amount of need. There were so many patients and so much to be done that I was inadequate myself to be able to do these things. So, what would be more impactful is if I was teaching. And in fact, after I left Uganda after 3 months, I'd recruited some of my colleagues there. Um, the staff that I trained there while I was teaching, I was training village health workers. The work went on. And within 2 years, even though I was there a short time, within 2 years, the child mortality was half of what it had been when I came. You know, part of that was that war was over and food was available and clean water became available. But what I learned is that by teaching, I learned more than I taught. The Ugandans taught me more than I knew. They knew their local culture and resources. I didn't know that. I didn't know tropical medicine. They knew that. And so that was really the beginning of my love of teaching. I already enjoyed teaching, but I realized it would be so much more powerful if my doctoring was connected with teaching. And so this lovely dance of teaching and doctoring, reinforcement, questioning, seeking information, new information, was really so rewarding. And I was able to do that in many different institutions around the world, first at Dartmouth, then back to the University of Wisconsin, Pakistan, Ethiopia, China, Brazil, so many places I had the opportunity to teach. Supposedly, I was teaching, but what I was really doing was learning and making connections and building relationships with people that have become my lifelong friends.
Now, you described teaching and doctoring, but at one stage you thought, I need to become a change agent. Tell me about that role as a change agent.
When I started medical school, only 10% of our class were women. Medicine was very dominated by men, and it was very patriarchal. Doctors would give orders to nurses or patients, and they should do what they were told, right? And I realized early on, number one, women were very mistreated as we came into medicine. We were told we didn't belong. Um, One of my professors actually showed pornographic images during his lecture presentations to make sure we were harassed, we were mistreated, and I felt if I'm going to become a medical school faculty, I want to change the way students are taught. They can be taught with kindness and with support and encouragement. They don't need to be harassed and ridiculed or mistreated to become good doctors. In fact, that was counterintuitive, counterproductive, in my opinion. And so there was a different way to be a teacher as well as to be a doctor. And I remember asking one of my faculty early in my residency, I'd like to be the type of doctor who makes decisions with patients instead of giving patients orders of what they must do, knowing that oftentimes they couldn't follow those orders. And so My faculty said, I actually don't know how to teach you that because that's not something that we do, right? So, so part of my motivation to become an advocate or an activist was I saw a lot of problems with the way medicine was practiced, medicine was taught that I did not agree with. I wanted to find different ways. And then as I looked out into the community, I found that there were so many things that needed to be addressed that were not about doctoring exactly. For example, the children I treated with diarrhea and dehydration in Uganda, it wasn't because their mothers didn't care for them or know what to do, it's they didn't have access to clean water. And so I began to get the idea that the role of a doctor can be a change agent to promote health in communities, actually to work with community leaders, organizers, elected officials to point out some of the challenges in the community and to say, actually, as a doctor, I see that there's a need for clean water because I can treat all the diarrhea and dehydration until I drop dead, and the children will still be getting it if they don't have access to clean water. And so it opened my eyes to the importance of public health, community engagement, and collaboration with others, because this is work that doctors can't do alone. But by joining forces with others, we can add our scientific training, our voices, our place in society that's respected to serve as advocates for community health. And so that became really the theme of my teaching and practice was community engagement and promoting health at the community level, not waiting for patients to fall sick and come to the doctor, although we have to do that because, patients do fall sick and we need to treat them. But we could take prevention out into the community and activate patients, activate people in the community to become leaders for health.
So finally, I'd like to ask you a question about the profession, because you've talked about community, you've talked about public health, you've talked about global health, but you've identified a problem within our profession, which you described as pathological workaholism. How are we going to sort that out?
This is a serious and ongoing challenge for medicine around the world, particularly, I believe, in areas where physicians are very short supply. There are so many health professional shortage areas. I mean, of the 8 billion people in the world, we know nearly a quarter of them do not have access to primary health care. So there are very serious health professional shortages. And part of the challenge of recruiting and training and retaining health professionals is the burnout. Because if health professionals are mistreated, if they're expected to work extremely long hours, if they're not given permission to take care of themselves and their families, guess what? They leave, or they're not interested in the first place because the work is too hard, it's too damaging, and it really kind of sucks your soul from doing the work that's most needed. So I believe we need to change the conditions of health professionals so that they can find joy in their work. They can find support by connecting with colleagues. They can rejuvenate by having conversations like these to look at the big picture and to say, this is worthwhile. This is meaningful. This gives my life purpose. And of course, I want to keep doing this work because it brings me joy, right? And so there's a movement within medicine to address the workaholism, the burnout, the overwhelm, and to make sure that people who are health professionals have the support they need, the camaraderie they need, and find the joy in practice so they'll continue this work for the long term. life is not all about work and suffering, but there's also a great deal of joy and meaning.
I love that idea of bringing joy and meaning to our work. And clearly you've done that throughout your life. Cindy, thank you very much for sharing your life with us. It's been wonderful to hear about all your adventures and your continuing involvement in medicine and healthcare. Cindy, thank you very much indeed.